Hi everyone, this is Guguletu Manana. Today I wanted to speak about art therapy settings. Where would you, as a practicing art therapist, work in South Africa? So these are some of the settings that practice in schools and clinical settings that would include hospital, hospices, psychiatric or units or institutions, settings, clinics, prisons, the elderly. You could work with children, adolescents, and young adults. So children would be in schools, children in hospital, children in various settings, really. Also provide like open studio programs and aftercare, after school and holiday programs. You'd apply a therapy in the workplace, law, and in other areas. So let's just start with schools. So how it's applied, you use it to help students to express themselves and cope with various emotional issues. It might be anxiety, depression, grief, loss, or behavioral problems. And also the students can explore their emotions, they develop self-awareness, and they healthy and learn healthy coping strategies. In relationships, it helps them to relate to their peers and learn much needed social skills and communication skills while enhancing creativity and promoting their overall well-being. And in clinical settings, so you would work with mental health issues such as depression, anxiety, PTSD, which is post-traumatic stress disorder, addiction. So this is not limited to these examples that I gave here, but it's proven effective because it provides a safe space for patients for clients to express themselves without being judgment or pressure to conform to societal norms. And through this art therapy mode, the patient can process traumatic experiences and gain insight into their emotions and develop healthy, coping methods. And also because they practicing themselves, learning self-mastery, their self-esteem grows, it reduces stress and increases feelings of empowerment and control over one's life, especially if they're in a difficult condition. In prison, how it applies, it's for rehabilitation and healing for in correctional facilities. The inmates can express themselves in non-violent ways, and they can process the trauma of being there for their whatever convictions, but also the trauma of being inside and being separated from everyone in everything that they know, and having to live in incarceration and deal with the decision that led them there. The inmates can develop skills such as empathy, communication, problem solving, and it reduces recidivism rates, and just really improves mental health outcomes for inmates both during and after they are incarceration. So it could be a continuous process for them just to keep them going and build emotional healthiness. And for the elderly, because they experience isolation, their children, they don't live with their children anymore, or they are at their age of they've moved out and maybe living in a old age home, or the children might be overseas or lost children, or they are on their own basically. Others are experiencing physical and cognitive decline. So this really provides a creative outlet that can improve their quality of life. They can engage meaningfully through activities and reminiscence about past activities, keep them safe, and express their emotion in a safe and supportive environment. So it improves cognitive functioning and reduces stress. It promotes, because it's geared in such a way that it promotes socialization and connection with others. and how we work with children, young adults, and adolescents. This is quite helpful and useful for them because they have difficulty expressing themselves verbally, because partly because of their language development and emotional development and social development, but also because of just growth and hormones. So it's just being able to express a wide range of issues: anxiety, depression, trauma, behavioral problems, if they have. So this is to develop self-awareness, learn healthy coping strategies, and also just resilient, building resilient. You want our children to grow with a growth mindset and being resilient. Um, they can work with issues on bullying, issues of rejection at school and being isolated, and issues of wanting to belong. Belongingness is quite big, and so maybe peer wanting friendships, and academic issues might be struggling with that, and just other life issues that are imposed on their children. So this is applicable to them as well. And how it's applied in the workplace, these are non-traditional settings. Law, this addresses burnout, stress, and other mental health issues. I know people work, when they go to work, we forget that you're still a human being. You still have, issues that are challenging to you. Yes, work might keep you busy, but taking care of the person that needs to work, of the person and the emotion, so that the person can grow and can provide an outlet for personal growth and development. And also, people who work, they experience life challenges. It might be relational issues, relationship issues, it might be interpersonal issues, but also I wanted to note is in the legal field, the trauma and vicarious trauma that is experienced by lawyers, judges, and other legal professionals, because they are so used to hearing all these um, sometimes dreadful cases and criminal, and what is done, to other, one person to another. So I mean, it's the experiences. It piles. Sometimes they don't have an outlet to release. So this is where a therapy can be used, and also in community settings to promote social change and advocacy through creative expression.